teenager or this young adult population have some kind of psychiatric issues affecting the stomach as well because the brain gets access. In your practice, is this getting common in your practice?
Absolutely. But in today's scenario, a lot of people, they like to be on the phone mostly, and a lot of people, youngsters, they're not going out and meeting socially like we used to earlier. We need to know when your child is having problems socially, or is it just on social media.
As a psychiatrist, you prioritize that dinner time as a family together.
At least one big meal if everyone is having together without screens, that can be a very productive time.
The biggest question is, at what age that we give the phone to the kid?
You as a parent can decide when you want to do it.
In children, in your practice, when you see depression or anxiety, how big a role is social media playing?
It is definitely.
The way that I see small kids using their phones, right? So like their 14, 15-year-old phones, you get dizzy. They are moving so fast. Snapchat is coming, Insta is coming, this one is coming. They know exactly what to do.
Because these are the kids who have been exposed to the iPad since they were born.
So as a psychiatrist, what is the top thing that you would recommend a married couple to do?
Number one, you have to take out time for each other.
If I have to ask you which is better, arrange or love marriage?
I've just seen this in my practice, okay? I can't tell about any others, but
Are you seeing relationship issues in your practice?
all the time. Because priorities change after marriage.
How about gender identity disorder, like transgender? Is that genetic as well?
It's not a learned thing. From inside, they just don't know how they are, like for a long time maybe. Or some children, they might know by around 3-4 of age that inside they don't feel like a boy or girl.
So mental health is the reason for the young heart attack sometimes.
Yes, it could be.
Hello guys, welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. I'm so excited for this episode. Actually, I think this might be one of the best episodes I have done on emotional health, mental health with a psychiatrist, Dr. Sonal. Good friend of mine from Mumbai. I was absolutely amazed by the information that she provided. And it was so helpful for all the people, married couples, parents raising their kids. How do we actually improve emotional quotient in the kids? How do we manage stress? How do we manage stress eating? What is anxiety? What is depression? Has this been word used very loosely these days? And what is ADHD, OCD? We covered a lot of topics, and I'm sure you will definitely learn something from this episode. And I'm sure that you'll be able to implement and improve your mental health quotient. No matter how strong it is, there is always room to improve. And I'm sure that will happen after this podcast. I was very excited for this episode as well. Let's dive deep into it. Hi, Dr. Sonal. Thank you so much for being here.
Hi, Dr. Pal. Thank you for inviting me. I'm so happy I could come and speak to you.
It's so nice of you. So nice of you. You are a very busy psychiatrist.
Not that busy.
Here in Mumbai.
Yes,
Mumbai.
yes.
And we're going to right into the discussion where I'm going to present you a case.
Yes.
Okay, so I saw a patient in California
Yes.
where she was 18 years old. Okay, and she has been having abdominal pain for a while. So they saw pediatric GI, as we discussed in US. Less than 16 is pediatrics, more than
Yes.
16 is adult.
Right.
So less than 16, they don't come to us.
Yes.
But seen a gastroenterologist before and then transitioning, they'll come to an adult gastroenterologist.
Yes. Yes.
So I saw the patient around like 17, 18. And then main complaint is abdominal pain. So we did everything. CT scan, MRI, EGD, everything has been done already.
Yes. Yes.
Nothing is there and everything is negative.
Mm-hmm.
And then I just asked her, okay, how do you feel? And she said, you're talking about the stomach? I said, yeah, stomach is okay. Then why did you ask the question talking about the stomach? Oh, I thought you were asking about my whole body. I said, no, what is happening? I just hate my body, and I am very depressed
Right.
about the whole situation. So that little thing kind of like put everything together in perspective,
Yes.
where we see a lot of patients where everything else is negative, but because of irritability of the nerve supplying the stomach
Yes.
and the intestines, we always see this patient. So to a point that 1 in 2 patients walking into my office from a teenager or this young adult population have some kind of psychiatric issues affecting the stomach as well,
Definitely.
because the brain get access.
Yes.
In your practice, if let's say this patient comes to you,
Yes.
is this getting common in your practice?
Absolutely. This is like one of the most common scenarios that I see in my day-to-day OPD. It might not just be abdominal pain, maybe pain somewhere else which can't be picked up in any other CT, MRI, or which a lot of doctors have seen and they've not been able to diagnose it. So pain is one presentation that I have seen and which has not been diagnosed. So in such a patient, there are other things also to look about, like apart from pain, does she have any other GI symptoms like loss of appetite? Has she really lost weight, or has she put on weight? And then I would also ask for other psychological symptoms, mostly about anxiety. You talked about depression, yes, but what about the physical parts of anxiety and depression? Like, does she sleep well? Or what is her relationship with food? And whenever she looks in the mirror, what are the thoughts that she is having? Is she able to control those thoughts or not? And how is it affecting her way of thinking? And how is it affecting her behavior? Is she able to go out properly? Is she able to mingle with friends? Is she like still on social media, or has she stopped everything? And how is her relationship at home with her family? Is she irritable at home? And whom is she talking to most of the times now? Is it just one friend? Or so is she really speaking her mind out? Is she able to do that? Is she able to understand what's going on inside her and how she expresses those thoughts? That is one thing that all the members of the family and people who are close to her that need to be interviewed also, and we need to find out from the family sometimes about what's going on with her. So it will not be just the patient, but the social things also going on that are important for me. I need to know how the family is looking at her, how
So
other
it's a
people
very
are
important point
looking
that you
at
said
her.
about the friend circle. So as a parent,
Yes.
we have to see how socially
Yes.
interactive they are.
Yes. Yeah. But in today's scenario, a lot of people, they like to be on the phone mostly, and a lot of people, youngsters, they're not going out and meeting socially like we used to earlier. So we need to know when your child is having problems really socially, or is it just on social media. So realistic and virtual, these are two things like the parent now has to know. It's like a child is always living these two worlds, and we don't know what conflicts are going on between them, and when they are separating, when they're becoming one. So this is something that the parent has to really dig down deep and find out.
Wow.
Because it'll vary from case to case as well. There are many kids who are just totally social. They like to go down, play,
Correct.
and but there are some who are introverts, and maybe they might not like to have a lot of big social circle. But these people could be active on social media because they don't have to show their face, or so it's like that. Like every child has an individual personality, and
As a parent, if your son or daughter is an introvert, should they encourage them to become an extrovert or go to multiple social environment, or just let it be that that is her personality?
yeah, it'll depend on the individual. Like some children do need that push. I've seen that. Like if you even if you just give them a little nudge, they just become extroverts, or they'll just become successful. But there are some children who are happy the way they are. They like to be that. They're more comfortable with that. So rather than we expecting us to follow a certain pattern, maybe we can just guide them a little about how things normally are, where you fit, and it's okay if you don't fit. Yeah, it's okay if you're not extroverted. If it's okay if you're an ambivert, or so just finding your place. That itself is a journey. So I see a lot of kids who are introverts initially, and then later after like 5-6 years they're like total social extroverts. That also happens. So we need to give them some time to find out their own pace and find out what they want. Yeah.
So finding out a son or daughter's character
Yes.
needs time to be spent with the kids.
Yes, absolutely. Yes. Yes.
Right?
Yes.
I have a feeling that is not happening.
Yes. Yeah.
Is that true in your practice as well?
Yes, and that has been happening. Many times parents don't even come with the child for the appointment, like if it's a little elder one that I see. So the person will come on his own, and they don't sometimes even want the parents to come, or even if they come, they'll be sitting outside and they'll be on their phones sometimes. That is a common complaint that I see. Children who say that they cannot relate to their parents about certain things, about the modern things maybe that they're talking about, or like
Mm.
the mother's always complaining that the child is always on the phone. But we also have to see how much time the mother is on the phone, the father is on the phone, how much of screen time is the family really having all together, or when it's time for dinner, is it like a time when all of us are talking and eating, or everyone's on their phone. So that kind of environment makes a lot of difference.
I see.
Yeah.
As a psychiatrist, you prioritize that dinner time as a family together.
Yes, absolutely. At least one meal in a day. It can be breakfast, lunch. In some places, it can be difficult to have all 3 meals together. But at least one big meal, if everyone is having together without screens, that can be a very productive time. When you feel emotionally connected to each other, you can talk about your day-to-day things. If you don't communicate, how will your mother or father know, or how will your child know what kind of things that you have in your mind, or what are your expectations from them, and how are they supposed to behave at home? So we need to keep talking about what we want and kind of environment at home. We can't just expect them to learn everything on their own. There are some things that they will copy from our behavior, but there are some things that we need to teach as well.
One most important question, I'm not sure here, but in US, any get-together that we are in, the biggest question is, at what age that we give the phone to the kid?
Yes.
And some parents are very strict that no phone until you go to the college.
Yes.
Some my nurse daughter is calling my nurse during the procedure. Okay, and then for something else. I said, who's calling? My daughter. I said, your daughter is only 7 years old. Oh yeah, she has an iPhone. So the daughter is calling.
Yeah.
So I am not sure what is the right answer. When should we expose?
So the American Academy of Pediatrics, they do have a certain recommendation. So maybe that is the only time when they can be allowed. But yes, owning a cell phone is like, I think, totally
It's a
different
big thing, correct?
Yeah. Because once your friend has a cell phone, and then that other person wants it. So that's how the conversation at home also goes. My friend has that cell phone, I want that one. But in every case, you as a parent can decide when you want to do it. You don't have to succumb under any pressure that just because your friend got it. You can just say that those are the rules of their house. Our house is different. These are the rules of our house, and these are the mottos of our house. This is how we are going to go about it. So these are actually good circumstances to make them understand about your family values and how they are different from other family values, without saying that their values are not wrong. But what I believe is this. So this is what we need to follow.
Wonderful. I think every family value doesn't have to be the same.
Yes, absolutely. And they're not anyway. Like some families have just a mother, some they are separated, or some are joint families in India. Like there are still many joint families. So every family has to have their own culture, and even it's a big culture, they have to have their own subculture. They have to have their own sub values, and how they want to bond with each other is a decision that the family should make on their own. Yeah.
I'm asking all this thinking about my family.
That happens a lot.
So what I'm saying is, so let's say the girl turns like 12, 13, or boy turns 12, 13 or something like that, right?
Yeah.
The interaction between, I'm going to select the girl as an example. The interaction between the girl and the mother is quite complex in that age.
Yes,
between 12 to 17.
Yes.
The girl thinks that the mom is absolute villain to her.
Yes. Yeah.
Why is that, and what should the mother do to counteract it?
Yeah. I think it's the way the daughter perceives the mother's behavior. Like sometimes a mother can be overly strict because she feels that the child may not be adept enough to handle situations on their own. So the mother might just keep a tightrope at home. And that is the age when children want to do things on their own. Like they have definitely been doing small things according to their age, but they're a little more intelligent than what they were generations ago. Like even between that mother and daughter, there's quite a huge generation gap. It's not like just one generation gap, but it could be many generation gaps put together. So the kind of intelligence and emotional quotient that child has is different from what the mother had at that same age.
Yes, of course.
Yeah.
Yes.
So then the mother starts to feel that the child should have behaved like this, like I was behaving, because it's almost the same environment. But we have to understand that these children are a little different from what we were. So we have to accept this change. And we have to modulate ourselves a little. And of course, we can't let everything go and let the child behave as they want. Of course, discipline has to be there, but the discipline should be there in a certain way so that there's not a lot of harm done to the kid. Like, it's okay if 5-10 minutes of overplay is fine. So you need to know how to draw the line over there. So I've seen this in many places. Like the mother and daughter are the closest because they spend so much time together. And then when the daughter is growing up, then all of a sudden the mother has to let go, and I think that's where then that conflict starts.
Right. Changing yourself to the daughter's requirement or the son's requirement is something very key.
Yeah.
And people say that you need to be friends with your kids.
I'm not very for this because your child has a lot of friends, but your child has only one mother and one father. So I'm psychologically speaking, a parent has to do what a parent has to do. The parent has to modulate himself or herself, the behavior, like not to appear maybe more strict or not to appear too lenient, but the middle path that the parent has to follow. It is difficult. Being a parent is 100%, it's the most difficult task I feel today. You can get a job, you can, leave your job, or you can just, there's so many other things to do. But being a parent today, in today's world, I think it's not as easy as it was before.
It is extremely hard.
Yes.
I'm telling you, I think we talk about peer pressure,
Yes.
right?
Yes.
We're not talking about peer pressure among the
Yes.
kids. It's
Yes.
peer pressure among the
With
parents.
yeah. So if you're a part of the group of moms, so there is a lot of competition going on over there also, who's on the highest and who's doing so much and who's being more active and who's not active at all. Yeah, that is there. Like,
That is there.
Here also, that's
Yes.
pretty common.
So on a scale of 1 to 10, I've seen different spectrum based on how they feel about raising the kid. Parenting is not like a single thing that you
Yes.
follow.
Yes.
So there are multiple varieties. I've seen moms and dads who are in that 10 out of 10, where there is no screen time at all. There is no ultra processed foods. There is no pizza, pasta. Even when they go for a birthday party, when they are giving the pizza, they bring their home
Own food. Yes. Yes.
That's 10 out of 10.
Yes.
This 1 out of 10 is like, that's okay, whatever it is. You leave me alone, I will leave you alone. You just take care of whatever it is.
Yes.
And then there is a lot of in between.
Right.
Correct?
Right.
From a psychological standpoint, from a psychiatrist standpoint, from this spectrum, which one will you say that people should follow?
Somewhere in between for sure.
In between.
7-ish maybe.
7-ish.
More towards letting the child go also and not
pull
being
back.
as at the same time. Yeah. So maybe some kids will be comfortable with the 10-ish part. Maybe some of them are like that. Yeah. But I think most of them would not like that. And so you have to assess your child individually. If you feel that the child is okay with that, the 10-ish or 9-ish and all that, then you can continue maybe that way. But for most of the kids that I see, I think that's 6, 7, 8, that should be good enough.
Okay. And you need to monitor your kids' growth slowly.
Yes.
And also the psychological...
Yes, absolutely.
What are the things that we look for?
The way they behave with others and with you. The way they talk about, they do express their feelings, many times when they're watching something and they ask you questions. So the kind of questions that they ask, that itself, it shows a lot of the way they are thinking. And then the other behaviors like how much are they eating? Are they sleeping well? Do they ever complain of physical things like pain? Or are they irritable? I think irritability is one thing that you can easily assess, and it's like, little children.
Like the kid or the parent?
The kid, yes. I think first we'll go to the kids and then to the parents. But irritability is easily expressed in the younger ones, the little maybe 2-3-year-olds who can't really express them well. But irritability is one thing where, and low appetite maybe is one thing where you can really find out if your child is going through some stress.
Low appetite is they were eating okay before, but not anymore.
Yes, and irritability, both of them. Like they wouldn't fall asleep so easily maybe, or the crying is there. So
when we talk to peer pressure, in US, the bullying concept is one of the big things.
Yes.
What are the signs that we could say that, hey, my kid is going through a bullying in the school?
Yeah. School refusal will be one of the most common things.
School refusal. I don't want to go to the school.
Yes, I just don't want it. The younger ones especially, they would just say that, that they would not maybe like to discuss about the bullying part, but they would just say, no, I don't want to go to school. I have a tummy ache. And they would just give it to something like
School
that. I have a
refusal.
headache or tummy ache or, I haven't done some homework and that's why I don't want to go. That is one thing.
I see.
But the elder kid, they might have other things about like less appetite, less appetite, and then less sleep, and they might even have thoughts of self-harm sometimes. If it just goes beyond a certain point, they can have that. And sometimes, if you're careful, you can just see a small mark on the wrist of a kid who has tried to self-harm. They would not talk about it. But if you just have a look at it, then you know that your child is going through some serious mental issue. Then you need to talk to your child about it. But the way they express themselves will be different. Some people would talk to their friend about it, and they would be scared maybe to talk to an adult. But definitely they would talk to their peers, someone who's suffering like them. Maybe they would like to talk to them about it. But if you have some good rapport with your child, and then I don't think it's really difficult for the child to come up and talk to the parent that this is what I'm going through. So
you need to open up a little bit to your kids, and kids should also open up to you, so that you develop that rapport.
Yes.
At the same time, you also have some kind of way to pull them back.
So the child needs to know that my home is my absolute safe space. If I go and tell my mother this, then the child should be able to judge what the reaction is going to be. Like if the child is always expecting a negative reaction, so then maybe the child might not be able to speak up that much. But if the child knows that, even if you just say, no, it's okay, and even if you don't talk about it, but still like the child will know that, yes, my problems have been at least
understood.
Yes, maybe, yeah.
He or she is able to confidently discuss with their parents.
Yes. And it might not be in one go. They might just start with something, and it might take even months sometimes for the child to come up with these things.
So, the other thing we usually see is, as a parent, we tend to compare. That's a common thing.
Yes.
We grew up like that, and we try not to.
Yes.
But I think invariably we end up either the peer pressure or doing something. As a psychiatrist, how important is not to compare?
Yeah, but we have been teaching this since like it's our basics, that you just can't compare one child to another because they're different, they're all together different. But for us, I think it's been going on since so long that I don't know how many generations more it's going to take to just break that. I think it's a little better than before. Like finally, our parents do know that comparison is something that we should avoid.
What happens when you compare one kid to the other?
Yeah, the other kid who is being maybe who feels a little lesser than the other one. So those problems, they just go prolonged. Like they'll always have these things in the back of their mind, even when they go into adulthood. That I was compared and I was maybe like a little less than what they had.
Inferior.
Yeah. So that inferiority complex, it might just go on into adulthood, and it might go on into other circumstances as well, like at work or when they get married with their spouse, or even when they are parents on their own. So it can have the small thing. It can affect the way you think about yourself for a long time. Even when you are like a mid-adult also, you can still these childhood feelings, because they're constant. It's not since you're born, it's been going on. You're realizing it. Maybe even if you expressed it sometime, but it's still going on. So, and you do spend so much time with a sibling. So that comparison part is something that goes on for a long time. Because even in my OPD, if I see some patients now and they talk about it, yes, like they faced sibling rivalry. And,
sibling rivalry.
Yes, they did face.
What is sibling rivalry?
It's like when they feel that the parent has been a little more towards the other sibling, and
towards the elder one.
Yes, and maybe it could be either. It's not necessary that or if they have three, so then the middle one would always say that.
Usually the younger one gets more pampered.
Yes, that, because most of the times there's a gap now in between the kids, like it's 4-5 years.
Yes.
So earlier it would be just 1 or 2-3 years, but now I guess that gap is increasing. So the parents have a little more attachment to the younger one, and as we are growing, they are still a little. The younger ones are still a little less like they're not that mature. So maybe they feel they need more attention. So, yeah.
But not necessarily.
Not necessarily. Like I told you, these kids are more intelligent and they have little more emotional quotient than we had. So their needs are a little different than what we used to go through.
So
Yeah.
let's say that, maybe based on the podcast discussion, people are more understanding and then trying to observe the behavior of the
Yes.
kid.
Yes.
Let's say they are identifying some kind of red flags. Oh, maybe he's not eating well. Maybe he's not sleeping well. Maybe she's not talking as much as it is.
Yes.
Maybe the friend circle has decreased
Right.
and the happiness is not there.
Right.
When is the time that they should seek medical attention?
All these things that you talked about, that is actually a warning sign itself. That is a warning sign that you know that your kid needs attention. So now, is it something that you and your kid can just do with? But if you feel that you have addressed the problem, okay, and these things are still going on, especially weight loss, lack of sleep, or being withdrawn, socially withdrawn, refusing school, refusing meals, and usually they're active on social media. So do you think they're less active? And has a child ever expressed that? They might say something like, there's no meaning in living, rather than just talking about self-harm. They might just say, what's the point in doing this, even if I can't do this? Or when they talk about low self-esteem as well. I think that is the time when you should definitely seek some professional help. Yeah. After you've tried, of course, on your own.
Right.
Yeah.
In your practice, in this age, how social media plays a role?
In parenting or
in children, in your practice, when you see depression or anxiety,
yes,
how big a role is social media playing?
Yes. It is definitely, because we know that children who are depressed, they are spending a little more time on screens. Okay, and then the kind of content that they are watching, it might affect them even more. They might be more socially withdrawn. They might not want to talk about their feelings, but they acknowledge that someone else is going through the same as well at that time, but still they might not want to talk about it. Then sometimes some children can go through cyberbullying.
Yes.
That is something that is really happening. I've seen some children going through it, and they have a lot of pressure within their groups also, within gaming groups also. They have a lot of pressure over there. So sometimes if you don't do as well there, you definitely go through some amount of emotional turmoil. So that could lead to anxiety and depression as well.
So you've seen patients where cyberbullying is, there's a game group
Yes.
and they're comparing and competing with each other.
Yes. And there, if they couldn't perform as well as they thought they could, or if someone just passes a comment in the comment section, you didn't, they will write not such good words about it. So this would really hurt the child, and they wouldn't know how to react to it.
Yes.
Because even though they know the level, but emotionally maybe they might not be as good as they think that they are, because they're still children. It's not like they're 18, 20-year adults and they could understand what the consequences of their actions are going to be. They're still trying to figure these things out.
Of course.
So, and having then too many conflicts, because it's not just one thing that you do on social media. You're multitasking on, everyone is doing this, I'm sure. You're not just looking at one window. You're looking at so many things at the same time. You're doing your homework also at the same time. You're listening to your mom also at the same time. Yeah.
Right. The way that I see small kids using their phones, right? So like they're 14, 15-year-old phones.
Yes.
You get dizzy.
Yeah.
They are moving so fast.
Yes.
Snapchat is coming, Insta is coming, this one is coming. They know exactly what to do.
Yes. Because these are the kids who have been exposed to the iPad since they were born. It's been like 13, 14 years, it's out. So there's this theory that went about at that time that when we were children, when we were babies and we were born, our mother used to, when she used to feed us, she used to look at us and she used to talk to us. But now mothers are on their screen. So when they're feeding their babies, the baby has to look at the neck now of the mother rather than looking at the eyes. So we're just worried about how this is, and this is something that's happening everywhere. It's not just happening in the US or in India. It's happening everywhere, in every country. So we are a little worried now how this is going to socially implicate.
Affect later.
Yes. What are the psychological changes at this small level? If it's happening, then how it is going to affect them later. Like what kind of bonding is the child and mother going to have after? Because eye-to-eye contact is so important. And if you're on your phone all the time, even at home also, it happens a lot of times. Like you're on your phone and that social contact or the eye-to-eye contact, it just reduces that. And it happens on its own. Like you don't want to do it purposefully, but it just goes on and
Goes on.
and it goes on for a long time. You don't even realize you're doing it until someone notices.
Right. The another very important thing I really want to talk to you is I got a call from my friend. Okay, and he's 44-year-old, and his son is like 15 years old.
Right.
You'll be surprised that he calls me privately to his house, and then he says that, Pal, I have a problem where my son is coming and telling me that I am gay. Okay, and he's telling me, what should I do? And he is very emotional. He's crying. He's like, I never realized, maybe I did something wrong with my parenting.
Right.
And he's very emotional. And I said, that's okay. I have to convince him a lot for almost like a couple of weeks before even addressing the issue, what is happening. So in US, in liberal states, gay, lesbian, all those things are like very common to a point that they're actually teaching that in the curriculum.
Yes.
In the open education.
Yeah.
And few parents don't like it to a point that they're changing schools. And they say, I don't want my kids to get exposed to these kind of thing. I am scared that looking at this, my kid will turn into a gay or lesbian, even if they are not.
Yes.
As a psychiatrist, what do you say whether it is genetic or it is society induced or it is environmental induced? What will you say?
It is genetic. There's no doubt about it. It's just how your body frame is. Yeah. You can see it in animals also. We've seen it in worms also. So it's just like that. It's just one more thing that has been, and it's been going on since so long. It's not just something that has crept up in the recent century. Like if you look at old books or even old paintings and all, they've been showing homosexuality also.
Even in sculptures.
Yes, obviously. Yes. So, it's the way we've been brought up that we have to be normal. You have or even young girls or boys, it's the gender roles that they have to play. If you're a girl, you have to have hair, long hair, you look pretty and wear pink dresses. For boys, it'll be that blue thing. And,
right.
So these are things that we've been brought up with, and it's been done so strictly that for some people it's difficult to accept something beyond these two things, that you can be either this one or this, you can't be anything else. So it's just the way we've been brought up like this. Now there are some people who definitely are broader mindset, and they know that even if there are certain choices like this, and people make those choices because their body part is like that, and it's because their brain is wired like that. It's not a disease. It's absolutely not a disease or a problem. It's just the way they are. They're born like that. Yeah. So it's not just gay people. There are some people who are asexual as well. Right? So they define themselves as asexual. There are, I think, 4 or 5 of them now coming up. It's not just gays or lesbians. It's the LGBTQ, the whole thing. And
yes.
So and then they are adding 2-3 more also.
Yes, LGBTQ plus, right?
Yeah.
I'm from California. California is a very liberal state, so LGBTQ plus is very common.
Yes.
People are now discussing that. Okay, so I understand lesbian and gay is based on how your body is framed.
Yes.
And it is something very genetic,
yes.
and they were just born with it.
Yes, absolutely. Yeah.
How about transgender and LGBTQ? Have you had a patient who's being brought by the parent that, hey, there is something wrong with him, he is coming out?
Yes, I see these things all the time. Yes, I have, and I've tried to convince parents. So some parents have definitely understood the problem, and it does take time.
It takes time.
It's not something that I can do in one session. So it takes time. And some parents...
So you explain that, okay, no, this is genetic, this is something they're born with it, this is nothing wrong with what he's thinking.
Right. So sometimes they just need a reassurance from the doctor that this is normal, and they have this last hope that maybe, the doctor says that this is not okay. Maybe we have a chance. So yeah, some parents do accept it, but there are some parents who will absolutely not accept it. Absolutely not. They're very rigid about it, and they'll say, no, you write some medicine for it, and you put them on an antipsychotic or something, so that they think that will change. Yeah. Some parents are really adamant. So it's going to take some time for this generation to understand, because it's just come out. All of these things we've been talking about it. Like it's always been under the wraps, even if it was still going on for so long. I think mental health itself, it's been so late we started talking about it. We've always been talking about other health problems, cardiac problems, blood pressure, diabetes. But mental health, I feel it's been ignored for way too long.
Way too long. I think the awareness came after COVID.
Yeah, because in court, so many people suffered, and they were talking about what they were going through finally. So maybe that is the time that even I'll agree to this. But in India, it's still talking about mental health is still not a priority.
It's a taboo?
It might not be taboo anymore, but it's not a priority for sure. Other things still take higher places, like the cardiac issues or other physical problems. And
your husband is a cardiologist.
Yes, he is. So,
yeah. But did you ever tell him that all his patients should take care of the mental health first, so the cardiac health will not happen?
Yes, absolutely. He knows that, and we have a lot of common patients like that only.
I see.
Because he sees a lot of young patients, and they go through immense stress, work pressure, family pressure, and that stress is what is causing other problems.
So mental health is the reason for the young heart attack sometimes.
Yes, it could. Yes, it could be. Apart from the lifestyle disorders, which are also actually stress-induced. Like these younger people who are ordering so much from fast food, Swiggy, Zomato, they are ordering it because they have not been able to manage their time well, because they go through so much of stress. They just want something quick on the go, and they have not been able to have a certain lifestyle, healthy lifestyle. So yes, stress, cardiac problems, respiratory problems. We know all of this is related. We know this for a long time actually. I've been studying it when I was a student as well, like how mental illness affects your physical illness. And even WHO also talks about health in a holistic form. You are healthy when you are physically, mentally, and socially well.
Correct.
It can't be just like one thing that.
Correct. Yeah. How do I know I'm mentally not well?
That's such a great question,
Before other people find out.
More important. Yeah. Sometimes a day comes when you don't feel like yourself. Okay. And you don't want to do the things that you would usually do. Like sometimes getting up and brushing and also can be a problem. Okay. And you find that you're not as productive as you were before. And there are certain psychological changes taking place in you. Like you don't want to talk to people as much as you did before. You don't want to interact with them. You don't want to do your day-to-day activities, or you want to withdraw yourself. And you have thoughts of gloominess and worthlessness, and your focus has gone down. I think these are certain like alarms that that you would definitely but there are other things also, like sometimes burnout can present like this. And for it to be a clinical depression, it has to have a certain amount of duration. Like for at least 2 weeks you need to feel like this for it to be clinical depression. So it can't be just one day, because we always have good days and bad days. Every day cannot be a good day. So it depends on the duration. It depends on the kind of symptoms that you have. There are some people who go through like mild stressors and they do okay with it. So and there are some people who have small stresses and still they react to it so much.
That's a wonderful point. Big stress, you're able to handle it before, but now even small stress, you are getting irritable.
Yes. So in that, it's the way we think about the stress, and it's our evolution based also. Like since we are young, we are taught in a certain amount of thinking, but then when we grow old, we also want to have our new way of thinking as well. And so sometimes when stress comes, we don't know how to think about it. Some new stress has come. We might not know how to calculate it properly, or how do we want to deal with it. This is a common problem. And sometimes if you're depressed, the way you look at stress differs. Like from a person who's not depressed and from a person who's depressed. Depressed, I'm talking about like clinical depression, proper clinical depression, where it's neurobiological, where your serotonin level, other neurotransmitters, they are not working as well as they would. So a person like this versus a person who does not have depression, if they are going through that stress, so the way either of them react to that stress is going to be different than as compared to each other. It's going to be different. So this person with depression will have no way out. He'll just say, nahi kuch nahi ho sakta. Nothing can happen now. But this person who is not depressed, he might have some ways out. So this is what happens in parents also. Like they don't realize that their child is really depressed, and they say, this is just a phase. It'll it'll go away. And,
So anything more than 2 weeks should be a concern.
yes, should be a concern.
Should
for
be a
sure.
concern.
Yes.
And
yes.
there are questionnaires available on websites,
yes,
correct?
yes, there are many. There are many.
For
yeah.
depression, there is something called PHQ-9.
Yes, PHQ. That's what you use in the US a lot. Yeah.
Yeah, PHQ-9.
Yes, yes.
Here, do you use that?
Not a lot, not a lot. But you know, NIMHANS over here in India. Yeah. We have so a lot of institutes, they have their own questionnaires. A lot of hospitals, they'll have their own. So whichever healthcare professional you go to, they will because there are many scales available now. It's not just one.
I see.
They have many scales. Then there are separate for anxiety, different for depression. There's different one for OCD and all. So there are many scales available. So it depends on the doctor, I guess, what he's comfortable with, what he's studied more. He would advise that. On online also, there are many scales available.
I actually looked up an online scale. Looking at the number of questions and the type of questions, I will get depression. So tell me.
So I really don't understand how it works. Like, are they really worried about you? Or are they scamming you? I have no idea. And I think I would take it with a pinch of salt if you really want to go through those scales or not. It would always be better to go through something that's known and just with a doctor if you discuss it. Even with the clinical psychologist.
Of course.
Yeah.
The reason I'm asking this is the burnout thing leading to depression is something that we are not talking about. Okay. I'm just talking from a doctor's field, but in all the other field, especially software engineers who are working so hard, and other professions as well, they're working late nights trying to match up with the productivity requirement. Let's say they're in a startup company. Everybody is so startled in a startup company to a point that they don't know what they're doing, and they all just focus on productivity, right? So there is a point that you will burn out. You are a body. You are not a machine. You are going to burn out.
100%.
In that burnout might produce as a depression as well. That is what is happening in medical community, and I am seeing that mostly here in India, where they are not giving themselves rest at all. I saw this report where second year postgraduate in medicine, they committed suicide.
Yes, it happens. I've seen
How
this.
sad that is.
Yeah, really.
Why is that happening? I don't know.
Right, because we are really not addressing burnout. We need to have stricter work ethics, especially for medical students, because they're still young. They're 19, 20 when they're doing MBBS, and they're hardly 24 or something like that. So they really might not be able to juggle everything together. Yeah, so we need to have that in all places, in all workplaces. I suggest that, and it helps improve productivity also. It's not like just one thing that you're worried about it, but look at the way it affects the productivity of the office. Like when you are preventing burnout, your creativity increases, and the way the product comes out, it will be definitely better than what it was if there were many people suffering from burnout. So work ethic is something that we all need to work on. The government has to have some plan if it's because it is something that is going to happen everywhere now. Even at home, we talk about workers outside, but at home also the mother has so much of burnout.
Of course.
Yeah. And
of course.
Yeah, dealing with everything, and we need to address that also
of
maybe
course.
as well.
In US, dad also have burnout.
Yeah, of course.
We don't have a choice. But I am really concerned about the exact point you're talking about, the mothers, right? So I'm telling you, I'll tell you a sequence of events that is happening. The girl is getting married around 24, 25, gets moved to a newer atmosphere, gets pregnant, baby is born, weight is being put on because of the pregnancy, and also from the marriage to the pregnancy, lots of food options and newer places and everything, and then weight is being increased already, and after the kid is born, the hormonal balance takes time. Unless you are very conscious of your diet and everything,
Absolutely.
that is just a slippery slope from there.
Yes.
And on the top of it, they take care of the cooking, the whole house to a point that they're not getting time for themselves.
Yes.
At what point that they come to you, or you're seeing patients like that now?
Yes, I am seeing these patients. Yes, I am. And maybe they come not as early as I want them to, because they would come when their child is like 2-3 years old, and they're already maybe preparing for another baby also at the same time. And I would like to see them at maybe like 6 months when the baby is already 6 months old, so that we can discuss about how important your mental health is at this time, because now everyone's focus is on the baby.
Baby.
Yeah.
Nobody
And
focuses on
yeah,
the.
yeah. So now you have to take care of your own. You have to take charge of your own health.
I'll tell you an example. Mother-in-law or even the mom's mother feeds the mom more than what is needed. Even the mom doesn't want it. Here, take the laddu.
No. Oh.
Take this jalebi. Why? Because it produces more breast milk for the baby.
Yes, yes. So that will go on for 6 months and all, like I told you. After that, they definitely need to, find a way out of how they want to balance their own mental health, chores around the house and all, how they want to go
So
about
you
it.
said after 3 years they come to you.
Yeah, usually after 3-4 years. They
What
would
is the
come.
problem that they come with?
They come with depression.
Depression.
For sure. Yes, yes. They don't have interest in the day-to-day things that they are doing, or they might not want to take good care of their child. They might feel that some parts I can neglect and I should not. Maybe.
Wow.
Yeah, that happens.
An
Yes.
Indian woman coming to a psychiatrist means how much amount of
Really,
right? Emotional
amount
damage that
of-
she's gone
yes,
through.
Yes, really. And talking about these things, like,
Correct.
because when you are growing up, you're being taught as a woman that these things come naturally.
Yes.
You're a mother. It's
Yes.
just absolutely natural. You have to go through this. It's okay if you don't sleep. Your body will cope up and all. So the kind of pressures, the way that we've been brought up.
Right. I'm going to give a shout out to all the husbands these days
Yes.
that they are pitching in. Maybe not as much as the mom want to, but at least they are taking a role of, okay, let's say you take rest, I will take care of the baby overnight,
Yeah.
something like that. That's happening slowly.
Yes, here also I've seen this scenario. It's happening a lot actually. Like I see working parents, and both of them have some balance.
Some
and-
balance.
Yeah, and the father is equally concerned about how the mother is.
Mother
doing.
is, yeah.
Yes,
That's a
I
wonderful
think-
thing. That's a
Mm,
wonderful
yes,
thing.
Yes.
But the more important thing is something called postpartum depression.
Yes. Yes.
All right. So when the baby is born in the first 6 weeks or 12 weeks,
Yeah. Yeah.
the women are at increased risk of depression to start with.
Yes. Yes.
How common is that, and what
Yeah,
do you do in that situation?
Yeah. So there are two things in this. There's one thing called as postpartum blues.
Blues,
Okay?
huh.
Yeah, which will not be depression per se, because when a baby is born, there are some hormonal changes which go naturally. The serotonin level is different. Oxytocin plays a role in that. So nature has made this on purpose so that the mother can accept the baby better. And there's a real strong bonding between the mother and the child, right? So it's difficult to comprehend all these hormonal things that are going on. You're not sleeping well, and other people can't really understand what you're going through, because we rear women our girls a little differently than what our mothers would rear us. Okay, so at that time it's really okay if for 2 weeks and all you do feel low, you can't really produce that much of breast milk maybe, or you're not sure if you can take good care of yourself and the baby. These things happen, and I've seen many women who go through postpartum blues, and then they learn to adapt and adjust. But women, there are some women who have already had episodes of depression in the past before they got pregnant. Okay, those are the women that need to be careful, because I've seen them come back to the OPD after for postpartum depression, and some de novo cases also I have seen, definitely. But in them I feel they have too much of stress also. Like maybe husband stress or whatever's going on in the house, that is also going on. Or some women who have difficulty processing their emotions, but from before only, from childhood itself. There are some people like that, who have difficulties processing their emotion. So the kind of person that you are, that is one thing that, yeah. Because we see a lot of women who do fine also.
Yeah.
They're absolutely okay with
Correct,
everything.
correct.
Yeah.
So symptoms that a husband or a family member can look for after the delivery of the baby to see when should we seek medical attention would be?
Yeah, crying, excessive crying.
Excessive crying.
Yes, and they express it then, like I can't do this anymore, or I don't want to live, and yeah.
This is too much for me. Can't handle.
Yeah, I can't handle it. Or they'll not be with the child as much as they would want to be. Not being able to sleep even like for an hour or two. Like usually when the baby's sleeping, that is the time the mother sleeps.
Correct.
But then they would not be able to sleep for that 1 hour also. Yeah.
Oh my God.
Yeah.
It's tough.
It is, yeah. Like I told you, like it's the way now girls are being reared. Like they're supposed to be equal to boys,
Huh.
but we need to realize that boys don't go through yeah. So
It is okay
somewhere,
to not to have gender equality in some
yeah,
situations.
yes, that is what I want to say. That in something like this, we need to keep teaching our girls. You know, if you want to have a baby, this is something that you are going to go through. So you can't just say that, why do I have to go through this? Why can't a boy go through this? So we are not advanced so much scientifically. So there are some things that gender-based you need to understand and accept it also.
Accept it.
Accept it also.
Mm.
That there are some things that women are really good at and they are going to do it. So yeah.
The gender equality also comes in the waist circumference as well. I said waist circumference more than 100 in men is obesity, more than 90 centimeters in women is obesity. Now, one of the subscriber came up to me and said, why we are not 100? We also want 100. So sometimes we cannot do our equal.
Yeah, but everything is different. The brain volume, the body
Yeah.
size, or even the way you metabolize drugs, alcohol, everything is different. So rather than going for something like equalizing it, maybe we come to a middle path where we can
Accept.
Yes, accept that there are certain things that according to your gender definitely is required. And
I think based on discussion, what I'm getting is the very crucial part is after the delivery, the mother needs to be taken care of.
yes, we
Mental
need to
health wise.
Yeah, because the baby is definitely taken care of by the mother. So we need to have a look at the mother more.
Exactly.
Yeah.
As we are talking about this, so the baby is born and everything. I'm just thinking about a very busy, like a working parent situation where they may or may not get any help.
Yes.
As the baby advances, all right, as the age grows, the baby, invariably, there is some kind of distance that happens between the couples as well.
Yes.
Invariably.
Yes.
Either because of work pressure, lack of time, or they are not exactly the same as they were married before. They were before marriage.
Yes.
Are you seeing relationship issues in your practice?
All the time I'm seeing this all the time. Yeah, because priorities change after marriage, and if you don't take a step and prioritize your marriage over everything else, then all these things come up. Then because it's very easy to happen. You're busy with your child, and then you just don't have, or you don't keep time for other things, like your own self for that matter, not for my husband, for your own self also. Sometimes you just don't have that me time. And so having a prioritization for yourself, I think, will be the main thing here. Then other things come. Your relationship with the husband should be there, how you are as a parent and work, and you need to learn to draw the line also. Say no sometimes at work also. Say no sometimes, or try to explain yourself in a better place, like, this is what I need to do and I can't do this right now, I'm really sorry. It's okay. You have to forgive yourself. Self-forgiveness is also something that I promote for these kind of people. That for prioritizing, you don't have to feel sorry for yourself all the time. And I'm not able to do this, I'm not able to do that. It's happening everywhere. Like, you're not able to do everything at the same time. So that maybe particular day you couldn't do it, but the next day you can do it, or 2-3 days later you can do it. So every day maybe you might not be able to spend that time with you wanted, but you can always do it sometime, maybe a week later also.
But the point that I've been seeing very practically is that let's say both are breadwinners these times, but one of them was the primary breadwinner.
Yes.
Where they use that as a substrate or a factor to say, hey, I am busy, I am earning money for the family.
Right.
It is your responsibility to take care of the family, whether I am here or not.
Yes.
I think that is where the issue is starting slowly. Where the other breadwinner I'm also earning money.
Right.
It's not only you.
Yes. It's striking that balance is really important over there, isn't it? Yeah. But I think it would depend on various people also, like the kind of situation that you go through. There are some people who know how to balance this part and who are okay with, being the lesser breadwinner.
Yes.
And doing other things. And so
as a psychiatrist, what do you recommend to the couples?
Yeah. To such couples, I would like them to have time just for themselves, with the child or the other thing, or the discussion doesn't involve money and So it's not necessarily that it has to be 3 hours, 4 hours, a movie or something like that. Just every day, if they can just spend 10 minutes doing a certain activity that they like doing yoga together, maybe doing meditation together, just going for a walk and listening to a song together. So when you do such small activities, you get a reminiscence maybe of the past things that are happening. The little ignition is always there. So So that little fire that is required. Yeah. So
Mm.
just spending 10 minutes even, and just communicating, spending 10 minutes is something that helps.
When I went to US,
Hmm.
I was amazed by the concept of like date night.
Yeah.
What is this date night? I've never heard of it.
Yeah.
I have seen these two
Yes.
separately. Date
Yes.
separately, night
Night
separately.
separately.
What is this date night? So then, in US, I mean, I keep saying US because that's where I
Yes,
am
yes.
practicing.
Yeah,
It's
yeah.
not like, I went to US and I'm doing a US lifestyle.
Yeah.
It's not the case because I don't do date nights anyways. So we started doing date nights after seeing my colleagues.
Yes.
And what they do is they hire a nanny,
Yes.
and then they make the nanny supervise the kids and they go for date night for 3-4 hours.
It's absolutely, this is so important.
Initially, what I used to say is that stupid people, they're spending money on the nanny. So then I realized how important it is.
Yeah. So unless you put an effort into any relationship for that matter, you're not going to get a good positive outcome of it. Like, how long is the other person going to bear it? At some point, she's going to have burnout. Some point, they are going to have a burst out, and those little friction is always going to happen. So rather than letting it escalate to a certain level, then why not treat it every day, as a part of your life? Like,
In your practice, are you seeing increasing divorce rates these days?
yeah, this younger people, I'm seeing this a lot. Divorce rates are increasing here, and the friction between these couples it could be related to something really small. Like, you didn't do this properly, and or you didn't get this properly. That's where the small things start, and there's nothing major. Like, many times I've seen there's nothing really major going on, but they have the sense that it's not really necessary to adjust a lot. They have their choice to make. I have a choice. I have my parents' support, maybe. So I really don't need to carry on.
There is only a fine line between self-confidence and the adjustment, right?
Yeah.
I have a feeling that the adjustment is not happening as much as it's supposed to be.
Yes.
I will never forget this. I'll tell you one thing. I keep on repeating this on the same podcast. In my wedding, an uncle came and he didn't say best happy wedding, nothing. He said, learn to adjust, and he left. Accept the way they are. And then he left.
Yeah. So, but both of them need to adjust. It's not just one spouse who needs to do it. Both of them need to adjust a little. Because for any marriage to work, even if you have a love marriage or if you have an arranged marriage, it is really necessary for both of them to sacrifice certain things. If it's something that both of them want to do together, it has to be done together. It will be a common thing. It can't be just my one spouse thing or the other ones. There are definitely some parts where it has to be individual also. But once you get into marriage, I think the V concept, WE, I think that's acceptable. Because that is what the institution is all about. If you just want to keep on focusing on self, so then the marriage part will not work out. It will not work out.
And in US, it has been divorce rates has been like
Yes,
always high.
always high. Yes,
because
yes.
they're entitled to their opinion,
Yes.
and they say, okay, no, if I don't like that, that's it. We have adopted so many. There's good and bad in everything. So I always say that always take the good from the Western and leave the bad, including your Western toilet. We don't want that. You're an Indian toilet. That's how your gut is designed. So I was surprised that a US born a colleague, she was asking me, so what is happening with the increasing divorce rates in India? I thought arranged marriages, there was not that much amount of divorce rates. I'm not able to wrap my mind around. Where as a psychiatrist, if I have to ask you which is better, arranged or love marriage?
I've just seen this in my practice. Okay, I can't tell about any others, but these love marriages, they are going through more divorces.
In your experience?
In my practice, I can tell you. But in general, maybe it's a gamble. You just never know what your partner is going to be. Even if you spend years of courtship, but how things happen when you go through a certain amount of legal commitment, and then when you start taking each other for granted. how that relationship is going to work out. So it's just a gamble. It's a matter of luck. If you're lucky, you get a good partner, even if it's arranged, or you're getting married a second time or third time. Yeah, so you just need good luck to have a good partner. Yeah.
The concept of when I was growing up over here, the concept of living in together and all those things were not there at that time.
Yes.
And it's very common now.
Yeah.
Is that something that you support, refute, or no comments? To know more about the partner.
Yeah. It's okay to a certain level. Okay, you need to decide where your boundaries are, because it is required. Like in a marriage, you need to know some things. Now you can't just like blindly, like how we used to do it 100 years earlier. We can't do that anymore. So if you have that choice and you know your boundaries and you can handle it, then I think you can go for it. But if you feel that you're a little emotional person, and after living together, if it doesn't work out, and will you be able to handle that break off or not? Because there are certain people who absolutely can't handle it, and they do really bad later on. So if you can decide on the boundaries and know what the effects are going to be, then I think it's okay. Yeah.
We are seeing a lot of late marriages now, right? 35, 36, because they want to settle down and then in profession, career, they want to enjoy their life a little bit more without the kids. And when the kids come, they okay, I'm ready for 37, 38 thing. There is pluses and minuses to it. Like pluses, you have your time and everything. Minuses is, as we know from a medical standpoint, as the age advances, the quality of the ovum goes down. And there is increased risk of abortions or
or autism children and
right autism, and increasing maternal age is one of the risk factor for autism. Do you think as a psychiatrist is this a concern, or is it okay as a society that we should accept?
I don't think there's much we can do about it. So we just have to accept it, because it's the way we are socializing, or it's the way we are evolutionizing ourselves. It's just become a way of life. It's happening everywhere. So we just need to accept it. Like, there are some things that you can do, like some people freeze their eggs and all and keep. That is something that you can do, or adopt kids for that matter.
Correct.
So to prevent these. Or we have a lot of diagnostic tests also now to know the health of the fetus. So
right.
Yeah. So we have medical technology advances as well for this.
So I had a patient where they actually biopsied the embryo.
Oh, okay.
So they did IVF. Okay, the same thing. It was a gay couple getting something like that.
Right.
So it was so gay couple wanted a baby, and they went through IVF or something, and then the embryo was formed. The donor mother had some genetic issues or something like that.
Right.
So there are techniques to biopsy that newly found 5-day embryo.
Oh. It's like too advanced. Okay.
It's so tiny. And they biopsy it. And then they look under the microscope, and then they find out whether the genetic abnormality is there or not. So as you said, the more technically advanced more advanced we get over culturally, medically also we are getting technical. There should be like a common match.
Yeah. But I still feel that nature has not made us this way. There are a lot of things that naturally they don't come to us, because we are having menarche at 11, 12 now. So that means nature wants us, to be healthy for reproducing at an early age only, not like at 40. So this is just a little against nature.
Against nature.
Yes. But there are so many things that we're doing against nature. So
like eating late at night. So as a psychiatrist, what is the top thing that you would recommend a married couple to do?
Okay, for a married couple, number one, you have to take out time for each other. It could be even just 5 or 10 minutes, but every day you need to take out this time for each other. Date nights are definitely important. Okay, you can do it once in maybe 2 weeks or 3 weeks, but yes, you have to spend time where it's just the two of you, not discussing anything else. And I feel expressing love is also equally important, like sending a message of I love you, or I'm thinking about you. No matter how many years of marriage you spend, that also is
somebody told me to do this. I said I love you to my wife. She replied back, are you okay?
Okay. No, it's really important. I think after some amount of time, you forget to express your love, or you just don't prioritize as much, but I know that people want to hear this. It's not just your wife, maybe even your child wants to hear this, or your friends, they want to have that acknowledgement of emotional needs, or that relationship that you two have. And I see a lot of people who complain that my husband is not expressive enough. Like, he'll do things for me, but he never says it. And I feel that if your wife feels that she wants to hear it, then you should say it. Even if it's like against your nature, maybe, but make a little effort and do say it, rather than just disappoint
Wonderful.
her all the time.
Yeah, of course. I try to do that. I do that. I say, this new dress is amazing. It's beautiful. She said, this is the exact same dress I wore yesterday. But at least I try. So initially, it will be awkward.
Yes.
It will be awkward because we are not a society where we express a lot.
Yes, absolutely. Absolutely.
In US, it's exactly the opposite. There might not be love, but they express it so much. They express it so much to a point that, hey, enough, ra. So sometimes I feel that as a community, we don't want to flaunt. We flaunt our property achievements.
Our children's achievements.
But I think you're absolutely right. So examples of expressing love. Okay, buying gift.
Yes, maybe not materialistic things I was
Materialistic.
talking about, like something non-materialistic, like when you do send that message, it could be with a picture of you two together, something like that, something that is a little creative also. It shows
nice.
effort. Like, it's not like you just wrote the 3 words, but like there's so many editing apps right now. So if you just, have a good picture and you've written this, I'm thinking about you.
Wow.
Yeah, so
Nice.
that effort has to show. And like I said, like tech is available now everywhere, so we should just use it. And
Right.
it saves time also.
Wonderful,
And if it can
wonderful.
save relationship, then why not?
Of course. One of my professors told me, in US, once you get divorced, it can be very expensive.
Right. Yes. So,
Something called alimony, that whichever the breadwinner, which a major breadwinner, needs to pay the other person for the rest of the life.
yes.
If the marriage is more than 7 years.
Okay.
Okay.
That's a 7-year itch.
7-year itch. Yeah.
Okay.
So I think so. I'm not sure, but that's how it is. So my professor told me, so there was a financial education conference. They say, invest in this one. Doctors, you guys don't know anything about finance. Invest over here. I'm telling you, this is the best thing. He stood up in the conference. He said, the best investment that a young doctor can make is date night.
Okay.
So
Yes.
you invest in the
Yes.
marriage to
Yes.
sustain a healthy relationship,
Yes.
so that you will save your finances. That's what their
Yes.
argument was. But I think the concept of expressing. The other thing people always say is that, okay, I don't have time. So I think what you're saying is
Make time.
make
Yes.
time. Because the effort needs time.
Yes.
Right?
Anything good, it needs hard work.
Needs hard work. Needs hard
something. Yeah.
Similar to how you put your effort to build your health. That's what my whole channel is about.
Yes.
After talking to you and multiple other podcast guests, I'm thinking that we should put effort for our mental health and also our
Physical
relationship.
Yes. Yes.
A lot.
Yes. Because what is going on around you, it affects you so much. The kind of people that you have with you. And we are still social animals. We need relationships. We need to have people around us. We really can't sit just isolated. Even if it's, we say that we are online and we are just on apps. But you do need your mom and dad. You do need your spouse and child.
If you think deep into it, the only person who is going to spend a lot of time with you in your life is going to be your spouse.
So, yes, especially if you're growing old and your spouse ends up taking care of you.
Correct.
Yes, if you want good care taken of.
And also, like you are the sandwich generation.
Yes.
Right?
Yes,
You are taking this 25 to 45, 55 is where you take care of your parents as well.
Yes.
And you take care of kids as well.
Yes.
And that invariably puts stress on you.
Yes.
Okay.
Yeah.
One of the most common things, Sonal, what I get in my channel is I talk a lot about don't eat this, don't eat that. This is ultra processed food. And to a point that people don't invite me for dinner at all.
Oh. Okay.
They invite me for dinner and they give water. Okay, drink.
I just invited you over, so. Okay.
So one of the most common thing that they say is whenever I'm stressed out,
Yes.
I eat a lot.
Yes.
Okay.
Yes.
How do you manage it?
Yeah. Okay. So the psychology behind it is when we are infants and we are crying, the first thing that the mother does is feeds us.
Feeds us.
Rather than just tapping a little, or
Ah.
the mother will just feed.
Feed.
So that's where we learn this. If you're anxious, you have to eat.
Ah.
That's where it comes from. Yeah.
Wow.
Okay. Yeah. And then the kind of relationship that you have with food, it just goes on varying. Like when you're a teenager, you might want not to, just some body physical experiments you want to do. And I'm not sure if they really understand the taste of food at that time. It's more of what your friends are doing, what they are eating, and the kind of advertising also. It makes so much of difference to what the teenager wants to eat. And though they realize that they're not supposed to have this, it's not healthy. Everyone knows it,
Yeah.
We don't need to explain them again and again. But still, the kind of advertising that they do, and then the kind of social pressure that they go through, that you have to eat this, though your mother is saying no. That is the time, I guess, where they are not really able to make that choice well. But then as you grow up and you start realizing that your choice is going to matter so much to you, then it's easier maybe at that time to make that choice about healthy and
About
unhealthy.
health.
So, yeah.
But when you are in that situation where you are associating stress with the food,
Yes.
do people come to you for stress?
Stress eating, yes.
They come to
Now,
you.
they come to me because they're already depressed, and stress eating has been seen commonly.
I see.
Yeah. So I would not get someone for just stress eating.
I see.
But I would get someone who has it because they are depressed or because they are anxious, or it could just be side presentation. It would not be the main one, but it definitely is something that we need
Got
to
it.
address.
What can one do if we are dealing with stress eating?
Yeah. The kind of thoughts that you have related to stress first, I think we need to know how to handle that stress first, like the correct way to handle it. Somewhere you need to realize that, I have stress and I need to have a good coping mechanism. This is not working for me. Okay. So there are so many other things that you can do, like in the fridge, rather than having those processed food. You can just keep a fruit salad or anything else that it's on your, like in the level of your vision of, you see it and you can have it. So that is one easy thing to do. And second thing is about like understanding that relationship and finding something else that makes you feel better at that time. Like, yoga has helped a lot of people in this. When you're doing yoga, or there's this thing called as mindfulness. So in that also, the mindfulness meditation and all that we talk about. It sounds difficult, I know, but once you learn it, and it's just hardly a 5-10 minute process. If you know how to do a little bit of mindfulness, that is something that really, it'll help you make better choices in everything.
Everything.
Like not just food choices.
So stress eating is not that you are eating because of stress. You are not able to cope up with that stress in a way.
Absolutely. Because you don't know anything else. Like how to cope up with the stress.
Wow.
Yeah.
So with yoga, with meditation, with
Walking,
taking...
simple 10 minutes of walking also, it
Walking.
releases so many endorphins and you can feel better just with that.
So you need something to calm you down.
Yeah. And you need to know what is stressing you out also. If you know, if you can reduce that stress level also, it will definitely help them.
I'll tell you I'm just talking about practical examples where patients have told me and friends have told me where, I think the biggest thing, you talk about social media, negative comments, your video didn't get that many likes, and oh, that guy is getting in Spain, beautiful vacation. Only that guy knows how many takes that he took to get that right picture.
Really, yes.
I'll tell you a story. I have a friend. He doesn't like social media. He doesn't like pictures. But his wife is absolutely on social media, right? So they have two little kids. And of course, they are not posting for the picture. They're posting for a family picture in a family trip to Mexico. And there's beautiful background. Anybody would want to take a picture, but this guy doesn't want to. But he knows that the wife wants to. So the wife and the wife tries to take a picture with the whole of our family, and the kids are not seeing the camera. Right? And then this guy saying, smile right now. Look at the camera.
Right? It's really sad. I see these things like we are teaching children to look at the camera. They learn it by reflex also. If you do it at too small an age, they will just learn that this is the thing to do. Like Like in this during the pandemic, like the babies that were born, they think that it's normal, not to touch each other or not to shake hands, or you have to do certain things only after you wash your hands, because that is what they've been seeing since they were born. They saw it for 2-3 years. So now I'm seeing that problem as well. Like post-pandemic, I thought it would be just anxiety and depression amongst people who are working or people who are at home. But now this is something that I'm seeing more about the way our children are learning these things from us, like how they're copying us, how the way we are looking at phones, and how we are reacting to the...
So that picture came out very well eventually, okay? And then everybody was like, wow, wonderful picture and everything. I know him very well. I called him, how did you get this picture? And he said, only I know how much amount of depression that I went through
to take that.
to take that picture. So that is one kind of pressure, right? Social media, comparing all those things. That is pretty common, it's been there. The another thing, it's a very nuanced thing that I'm seeing is WhatsApp has been a wonderful thing for many people, right? Whole India is on WhatsApp. When there is a one-to-one conversation and that doesn't become any problem at all, where you can express your thoughts. When it is in a group, when you're sending a message, it becomes like a performance evaluation rather than interaction.
Yes, absolutely.
Have you seen that?
Yes, but it happens on all platforms also. On Facebook also, my friend posted this, and so somewhere I feel that I also wanted to do something like this, or maybe now when I do it, I want to do it better. So this is our human nature. Competition is there. That is there. But we need to learn where to draw the line. How much do you want to be affected by without knowing that person's story? How much do you want to be influenced by it? That is something we need to evaluate on our own also.
And I always say to me, no, don't send any messages with deep meaning in WhatsApp or Facebook or message, nothing. Because written format always creates anxiety.
Yes. I agree to this.
Right? So it's better to talk because the tone differs and everything. The reason I came to know about this is I always say that, don't look at your phone 30 minutes before because you need a sleep routine. Sleep is extremely important. So what many people tell me is that's the only time that we get. And I won't keep on sending messages. So in a group, there was this popular Tamil movie release where they were talking about the actor. And this guy is saying that, okay, this actor doesn't know how to act. And there's a group of like 20, 25 people. And one guy is saying that, okay, you know what, your hero knows how to act. You are fair. So they're going back and forth, right? And he finishes the conversation and goes back to sleep. And the next day morning, the first thing he does is opens up the message and see what is the reply. He told me that. Then I realized that, okay, there's something called subconscious mind while you're sleeping, right? The last thing that you...
Yes, it happens. It happens, But, there are a lot of people who look at it as an escape mechanism, something that they couldn't do in their youth, and now suddenly they have a group, and you don't have to present yourself in a certain amount, or you're just typing something, and they don't know what the real picture is. But it doesn't matter what you're typing much, like, because when you're on one-to-one, it's so different. You can fight or you can argue, but on WhatsApp, how much, like, it's such a different level of arguing that is going to go on. So some people do look at it as an opportunity to finally express themselves, something that they wanted to. But some people could do it as a way of looking down on others.
Correct.
That also happens.
I'm telling you, many people have called me and then said that, hey, I'm not able to handle my emotions after saying that message. How can he say that to me?
Yes.
I'm sure he's saying about me. While that person might not even have talked about him.
Absolutely.
So that is so common. I see this all the time. This is all the time. And then I am a big proponent of decreasing the cortisol levels. And I have a strong feeling that cortisol is the main reason for belly fat accumulation. Because cortisol is a stress hormone, as you know. It stores all the calories in the belly, thinking that you'll need it somewhere else. Every time you do this, there is a short pulses of cortisol that is being released and you don't need to do it.
Right.
So then again, it boils down to to is there is a stressor that is happening and you're not able to cope,
Yeah.
which means that you don't have the bandwidth to handle this, which means you need to prioritize yourself to create that bandwidth.
Yes. Right.
So you talked about mindfulness meditation, right? So that is one thing that I do I do Heartfulness. It's a non-profit organization. I absolutely love it. It is something that has helped me a lot. So I do, initially it was extremely difficult. Do you recommend that to your patients?
Yes. Yoga.
Or any kind of meditation?
Yes, definitely. Yoga, I think Indian people have been doing it for a long time. But there are certain things in yoga which I would recommend for mental health. All the breathing exercises that you do, pranayam, avalom vilom, they really have some, scientifically also it's been proven now, they have certain effects on the brain. So all the yogis and all that, they were doing all this. It's been proven now that they had certain advantage over mental health issues, especially, or maybe like in preventing dementia for that matter. Maybe the way the brain was spaced according to these yoga things. It's there. It's a science on its own, right? Mindfulness is definitely. It is also actually an older Indian concept itself, but it's just revitalized and it's been reinvented. I'm really happy about it. Yeah. So there's this famous monk, Chatna. I don't know if you've heard about him. So he had promoted a lot. He was in France and he had this Plum Village Society. And So he's expired now, but he wrote a lot of books on mindfulness maybe like 10 years ago, and that pace picked up, and now luckily everyone is talking about it. But it's actually an old Indian concept itself. It's a Buddhist concept. So we've been giving the world all these. Yes.
There is a hot yoga in my neighborhood.
Yes.
In Sacramento.
Okay.
You go to the hot yoga,
Yeah.
and then yoga is like Taylor Swift song is in the back.
Okay.
And then they're just like doing all these poses and everything. And then finally, once the Taylor Swift song is done, they say, Namaste. He said, no, it's not Namaste, it's Namaste. So I think it's high time that we adopt our own practices. With time.
Yes.
So how does meditation help the mind?
Meditation helps you organize your thoughts, which is so important. Like it gives the brain a kind of an exercise training. Like you have to calm down, because your brain is continuously thinking on its own also. That's its job. It is continuously thinking. But you have to decide the kind of thinking that you want to do, the amount of thoughts that you want to think about, and how much importance do you want to give those thoughts. Yeah. So I feel that meditation helps you organize your thoughts in those ways. It gives the chance, the brain a chance to relax and prioritize itself also. So the brain definitely needs a certain amount of time with no thoughts, like nothing stressing about it. So you need to give that chance, and definitely meditation helps in that.
Meditation helps.
Yeah, but there are certain amount of people who can't meditate. Okay, and I understand their problem, because they have a problem, a really maybe a serious problem organizing their thoughts, and they would not be able to meditate. And I think it's okay for them. If you can't do this, there's something else that you can do. Like in yoga also there are so many things, or like we talk about exercise, walking. So maybe that also helps you. So this is not something for everyone. It's okay if you can't do it.
In Heartfulness, they say that anybody more than 12 years of age can adopt meditation practices.
Okay, yeah.
As a psychiatrist, how important it is for kids to adopt meditation at a younger age?
Yes, it is. It is important, because when we're teaching them at that young age, it is going to help them all throughout. And yoga is something that even little children are doing, yoga and meditation, both of them. They've been doing it in schools also. It's become a part of their curriculum. Like we had PE. So apart from PE, they have yoga also. Yes, they do.
Nice.
Lot of schools have adopted.
Nice.
My kid has
Beautiful.
yoga. Yes, they do have it. So at this young age, when they are learning how to take care of their physical needs, emotional needs, and through meditation, if they can know how to control their thoughts and the pacing of their life. Yes, it is definitely.
Nice.
Yeah,
How young is your daughter?
She's 11.
11.
Yes.
11.
Yes. Yeah.
We talked about briefly about this. Does she know what she wants to become when she grows up? Or do you know what she has to become when she grows up?
I'll just answer it a little differently, more general way, I'd say.
I'm just joking. So the question is, many people
Yes.
have told me, I could do talk shows.
Yes,
I do
yes.
talk shows. It's a 90-minute show where we interact with the crowd and everything. And there are little kids that comes and watches my show as well. So they're like between 10 to 14.
Yeah.
And I ask them, hey, what do you want to become when you grow
Yeah.
up?
Yeah.
The mother nudges the son and then says, doctor.
Typical Asian moms. Huh? Okay.
Doctor. So I think now we are better that,
Yes,
it's,
maybe way beyond that
it's
now.
not become engineer or
Yes,
doctor.
yes. There's so many more things that
so many
people
more
are
things.
doing also now also, on their own also they're making that choice that this is not the only thing that they want to do. They know that they can excel at something else as well.
The pressure that, let's say, I'm just saying a hypothetical situation where a parents wants them to become a doctor and the kid is also doing okay. But the pressure, is there a line that they should draw in terms of how much we can push the kid or how do we monitor that?
Yeah, there are some kids who are self-motivating, like they really do want to do it, and I think that's good. Then let them do it. But if you feel that you're not sure if the child really wants to do it or not, then I think you should give the child a chance to think about something else as well. And you definitely need to know where to draw the line. Like a certain push is definitely required, but it can't go to the extent that you're making all the decisions for your child or you are deciding the path for your child. Your child has to find his own adventure. Yeah, so you can definitely guide because your child needs your guidance. Your child needs your motivation. Your child needs your appreciation. Yeah, but there is, but that's a job, and our job is also to make them self-sufficient. So we can't make them dependent on us for all these decisions. Our main job is to make them self-sufficient. Yeah, so we need to look at long-term goals as well. Have I made my child independent enough to is he going to be happy when he is independent? We should maybe think about these things also, not just rich.
Yes.
Or not,
Yes.
is he going to be happy?
Correct.
Is he going to be socially adept?
Correct.
Is he going to have a good social circle, friends and family? Will he be able to maintain his relationship with his spouse?
Correct.
This is the kind of questions that maybe we should be asking
Of
ourselves.
course.
Yeah.
That's a wonderful point.
Yeah.
It's a wonderful point.
Yeah.
I have a feeling that we are missing the bigger picture where, academic is not the only success.
Yeah.
The other thing that we usually talk about is the emotional quotient or emotional intelligence
Yes.
of this. I wish somebody has taught me while I was growing up in terms of the emotional aspect of all this, where I came to know about this later by myself. I always tell Priya, my wife, is that, my kids, I'll be so happy if they're emotionally strong, where they're able to handle different situations at the right level.
Yes.
How do we instill that emotional intelligence in a kid?
Yeah. We have to teach them by our own behavior. Like they're constantly observing us and they're constantly learning and copying us as well. So the kind of behavior that we have in our house with our maids maybe, with the work, with the help that we have, or then with our contemporaries, with our colleagues, with our seniors. So children keep observing that. And then when we change our behavior, we're behaving in a certain manner. So maybe that is when they realize socially how we are supposed to behave and be accepted.
Wow. And somebody told me that don't ever argue in front of your kid or something.
Yeah,
right?
you should avoid that. Definitely. Yeah, whatever arguments between the spouses, it should be within a closed room.
Within a closed room.
Yes. It's important for the child, for his own safety, to know that even if things are going wrong or not, we don't know, how that thing is going to go. You might be able to solve it within an hour or something, but the child might keep thinking about it for a couple of weeks and might affect him emotionally. It's important.
So I went to a friend's place, and then the kid was I love kids. Kids love me for some reason. Okay, I love kids. So this guy, he is 7-year-old, 8-year-old. He came to me and he said that, Uncle, Amma is very mad. I said, what happened? I don't know. Appa left the home, took the car. Amma is very mad.
Yeah.
He's telling me that Appa is not at home, so you go.
Yeah. Okay.
He said, come back later.
Actually, they're intelligent.
That kind of struck me that, he's very 7 or 8. So they're so observing.
Yes.
To a point.
Yeah.
The other thing I want to discuss was, okay, if let's say a young 25, 26-year-old, the other most common thing I see is when they are having an off day, I say, how are you? I'm depressed.
Oh, okay. Okay.
Where depression or anxiety or mental health issue. Yes, it's a good thing that there is a lot of awareness now, and it is a wonderful thing, the taboo is leaving. But at the same time, what is happening is they are using these terms very loosely.
So it's a kind of language they have for everything. Like Taylor Swift's song, I want to kill her, I want to kill him. This is like her latest song has this, and I'm, as a psychiatrist, I'm really worried that really is this the kind of songs that these young, she has fans like 6-7 year old also. Is this what they're going to hear, and how is it going to affect the way they're thinking about killing people? Like, she's expressing it so like in such a casual manner. So this is what the language is going to be. Then how do you know then when what that person is really feeling, or what that person really wants to say? How will you know how their mental state really is? So we need to come up with new terms. Maybe as a psychiatrist now we will need to change the depression phases or change the nomenclature so that people don't misuse these.
But are you're seeing that, right?
Yeah. I'm seeing that definitely. I'm sad today. Or, It's good that they can express themselves, but I say, why do you want to focus on the negatives? You had so many good things also in the day. It's not like you were just depressed. Like you're just talking about a certain amount of time or a certain period of time. Why don't you talk about the other periods of time as well? So it's important to generalize the day maybe if you can.
So the one small trick that somebody told me is that every 8 hours or like breakfast, lunch and dinner, you mean, asking yourself, how are you doing? How am I feeling now? Happy, sad? In between. And you will be surprised and amazed how important that is to check within yourself.
Yes, it is. And we have to accept that we are going to go through certain amount of emotions in the whole day, and we need to be prepared for it. And it's okay to feel sad for a certain amount of time. It's okay to feel anxious also for a certain amount of time, because it's the body's response. A little amount of anxiety is required for good performance. If we know the learning curve over there, we have that a certain amount of anxiety level is required for really good performance. You can't be like just zero anxiety and not do really well. It happens with only geniuses maybe, but for us common people, we need to go through these emotions because nature has made us that way. We are naturally like that. That's what makes us humans. And the whole system also, the neurotransmitter system, the endocrinal system, that all runs on this level itself.
The other term that's been very loosely used is ADHD.
Yes.
Okay, and I can tell you right off the bat, in any so in US mental health issues, so here's a top. Everybody has their own boutique and then treating patients, right? So everybody is, I'm not able to focus. I have like this thing. So they give a ADHD diagnosis. ADHD stands for Attention Deficit Hyperactive Disorder. When I was in my medical school, I was under the impression that it happens only in the kids.
Yes.
Can that happen in adult as well?
Yes, it can. It happens when you have childhood ADHD and it carries on to adulthood. Because usually what happens is around 7-8 years, your ADHD comes down, and by the time you're 10-12, it disappears. But now we're doing further studies and we've realized that there are definitely a certain amount of people who have developed who have gone to ADHD also. Now, I don't think it's something de novo, like you can't just have adult ADHD on your own, That would be a different thing. I think it needs a different diagnosis completely.
I see.
It's something that you would have had since childhood.
I see.
Yeah. And then maybe when you're an adult and you are going through certain things like maybe depression or drug abuse, substance abuse. So that is a time when maybe your focus is a problem, concentration is a problem. So being diagnosed by a proper doctor is what is required to have your ADHD diagnosis. You can't there are so many things in play. It can't be just one.
Just one thing.
Yeah.
What are the signs and symptoms of ADHD in young kids?
In young kids, hyperactivity. Like you'll see that they can't sit at all. Even in the classroom, they'll be doing something to their body, shaking their legs or hands or whatever is there in their hand, they'll want to shake it. So that is it, hyperactivity. And some teachers do complain that they can't even sit around properly in class. They just need to roam around. So for the younger kids, this happens. And for the elder kids who can't like really handle the body movements, they'll be having some shaking or trying to relax distracts themselves by certain yeah. Now apart from that, there is the thoughts that they can't organize properly, so the hyperactive thoughts that are there. So something is going on, they can't concentrate on it. That is there are two parts of that ADHD. Yeah. So the teacher will notice that the child is looking here and there. They're not focusing properly. And some children who have a higher IQ, they'll be able to cope with all of this very well. Even if they have ADHD, they'll answer everything. Or even if the teacher feels that they're not attentive, still they'll answer everything. So, and like I told you, some children just grow out of it. So it's not really much of a problem at that time. But yes, when it's like 10th, 12th board exams and all, and that ADHD is still carrying on. So we need to be aware of these symptoms at that time also, because the child needs focus at that time.
At the time.
Yeah. In some people I've seen, it's more of like a fashion statement when you are on some medicine
right?
for ADHD. Yes, they do that in colleges over there, so that there's this certain medicine for ADHD.
Right.
When you take it, it helps you focus better actually. So then
like Ritalin, amphetamine.
Yes. So a lot of people just want to experiment that.
Correct.
It helps them focus better.
Similar to ADHD, the other issue that we usually deal with is OCD.
Yes.
OCD.
Yes. Yeah.
I think OCD is also loosely termed on multiple occasions. OCD sometimes is very severe, where they just will compromise the quality of life significantly.
Yes.
Just checking the lights couple of times, whether it is switched off or not, maybe not a significant OCD.
Absolutely. So they've changed the name. It's not OCD anymore. It's OCD spectrum. Because there are so many things that go into it. You can just have obsessive thoughts and not act on those thoughts also. So that is also a little bit of a problem. When you just keep ruminating about certain thoughts, it's called as obsessive ruminating. Yeah. So and over there, then again, it reduces focus and output is reduced. So that could be a problem. And where you have no control over your thoughts. And then acting on the compulsion part of it is there.
Can you share a patient experience with OCD?
Oh, I have many. Many.
Like an example, so that we can understand, okay, so if this is a clinical profile, probably it's OCD.
Yeah. I see a lot of families who don't bring the patient on like early on. It would be at a certain phase, like when maybe the son is getting married, and then it becomes a little too late also, then, because sometimes medicine won't act as fast as it would if it was something newer. Like this hand washing thing that goes on. I've had a case where the mother would be so strict. The children, whenever they came from school, they would, the first thing, even outside the home only, they would have to take off the socks and all and make sure that everything is arranged properly. If they didn't do it, they would get a beating for sure, and they were really scared about it. And whenever she was cleaning the house, everyone had to be either out of the house or in a certain place only. And it affects the children, of course, because then later on I saw a youngster also whose mother had the same problem, and then they would also, they would be in a conflict, like what is right? Is it right to keep, washing all this because I've been seeing my mother doing all this, or do you think I'm also suffering from OCD? So it becomes a dilemma at that time. How do you diagnose it? How do you treat it at that time? Wow. So it's not just the hand washers, but there are things, the spouses that I've seen, if a spouse is suffering from OCD, so how the other spouse also has to suffer, because that spouse will make that other person do the things, rituals or other things that the patient wants to avoid. So it's difficult for the spouse especially to adjust with these kind of people. And sometimes as a parent, you're in a conflict if you should do that compulsion or not for your child. Your child asks you, for the obsession, they do a compulsion. So you're not sure if the right thing is it, do I have to follow it or not? Like your child might have this compulsion of asking questions. So the same question repeatedly, that is one really common OCD that I've seen. So then the parent is confused, and then they come to me like, should I answer? Should I not answer? So it's a strict no. Every time you have to make sure that the compulsion is not followed.
The last thing we'll touch upon is the suicidal rates.
Yes.
Which age group is common?
The youngsters, definitely.
Youngsters.
Definitely, yes.
Youngsters, you're talking about 15, 25?
Yes, 15 to 30, yes.
15 to 30?
Yes, 15 to 30. And that too, students, definitely, like during, I know, exam results time.
We're
still having these increased suicidal rates during that time. Yes.
After the NEET exam?
Yes, it is. Because a lot of students are frustrated anyway. They've been trying it 2-3 years and nothing's working out for them. And they could be going through depression also, going through the same things and not being able to cope up. Maybe they have less social avenues to express themselves, or they don't have enough support. Yeah.
So all what we talked about so far kind of like boiled down to having a strong mental health right from your childhood
Yes,
kind of thing.
yes, yes.
So you need to kind of like focus more at the younger age so that you have a strong emotional quotient
Right.
to handle all these kind of stress. So we don't
Absolutely.
end up in doing this.
Yes, yes.
So if that is what the final solution is, what has to be done during those years or even now when somebody needs to start? What are the things that you will say?
Right. First of all, let's not focus on the eating part. Like parents think our primary goal is just to make some good food and feed them. Yeah. So I think we need to look at a healthy child as an overall thing, like as physically he has to be healthy, mentally he has to be healthy. So we need to look at a child as a holistic thing, that we can't just keep focusing on just one thing, that we want the child to do this rather than that. And the second part is, like I told you, we need to change ourselves also a little. We need to unlearn some certain things, that so that the child understands that the parent is doing this. The parent has taken an effort. Like sometimes we do make mistakes, and we need to accept that yes, I did this mistake, and say sorry sometimes to the child. It becomes a good behavior. So when you change your behavior, when you adapt new behaviors and good behaviors, that is the first thing that the child will see and learn on its own. So this is not something that is communicated. The child is seeing what you are doing. The child is learning what you're doing. If you are on your phone less when you two are together, definitely the child will know that it's really not necessary to be on cell phones all the time. But if you are yourself constantly on it, then the child knows that this is the thing to be done, because my mom is doing it, my dad is doing it, my friends are doing it. Yeah. So your behavior is going to influence your child's behavior.
I had a very specific scenario. I don't want to discuss that with you. Personal situation where one of when I started YouTube, right? This was like I came into YouTube as an accident, but all of a sudden videos got viral, and so many things were happening at the same time. It was all new to me.
Yeah,
right? I've never seen all this before.
Right.
So we had 2 kids at that time, and my older son Arjun was 4 years old, 4 or 5 years old.
Okay.
4 years, 4.5 years old, and the younger kid was just born at that time, like 6 months, 9 months, something like that. So I had a tendency to, hey, what is happening? My video is going well. Okay, so what is the response and everything? I was looking at it. My Arjun came to me and he said, "Appa, put your phone down."
Okay.
Put your phone down and then play with me. So
They do that, yeah.
That little incident was a wake-up call for me.
Yes.
I was like, what? Wow.
Yeah.
So I have been doing something that he doesn't like.
Yeah.
He comes to me and he says, "Appa, no phone."
Yeah, because he wants your time at that time. And then when they grow up, maybe they want to do their own things. But when they're really small, I think they want our attention.
They want my attention. Yeah,
they
want attention.
want that. It's natural.
It's been natural. So I said, since then, no matter how busy I am, that's why I also tell me in my videos is that focused quality time, no phones, nothing.
Yeah.
At least for 30 minutes or 10 minutes at least, whatever.
Yes.
Whatever you can, even though you're so busy.
Yeah.
That part I do very well. My kids part I do very well. Husband part only.
But in the end, your wife is going to take care of you, not your children.
I'm getting better, but I'm doing date nights now. So you said to no, don't focus on the eating. Focus on
Overall health, yes.
Overall health.
Yes, yes.
What-
Sports, physical
sports.
things, yeah. Let them get into a team kind of a sport, like football or anywhere where you are required to interact with others and work as a team. So that increases a lot of social awareness as well. You know where you stand, and
Correct.
you can learn how to handle defeat. That's how sports become so important, because we can't be successful all the time. And then maybe somewhere we are not teaching our children this, so they don't know how to handle failure. Yeah. So as a parent, I think somewhere we need to work on that also. No?
It's a very, very important point. Very important point that you need to handle failure.
Yeah.
I still remember that I used to play chess. I was pretty good at it. Under 14, I was a national second, third, sometimes at that time.
Yeah. Yeah.
I couldn't handle defeat in 8 years, 9 years old.
Right.
I was like, how can I can't lose? There is no way.
Right.
How can I lose? Then something in me told me that, okay, so that factor should never happen to my son. That is very important, very critical. So every time what I say is that when we play a game, I say that I make him lose.
Yes. Yes.
I say, Arjun, it is okay to lose. It is okay to lose.
Yes.
That is something very important, correct?
Yes. Right.
It's
Yeah.
very,
Yeah. And I feel that you should not treat the successes like a very big thing. Like, just because my son is first in class, so it's a big thing. So it has to be a little balanced. Like, your failures are also okay, your success is also okay.
Okay.
It's not, if it's coming, it's really nice. But if it's not there, that is also okay.
Yeah.
So there's no need to really be very overjoyous about all the successful things, and so that they learn that failures are also okay. Because when you are just focused on the success part, then they just don't know what failure is.
That's a very important point.
Yeah.
I think Indian parents are significantly lacking that.
Yes.
I can boldly say,
Yes.
at least in my experience, what I've seen so far.
Yes.
Wow.
Yeah.
Wow. Wow, what a discussion. It's an amazing discussion.
Yes.
Thank you so much.
Oh.
Yeah, I absolutely enjoyed.
Yes. Yeah, me as well. I enjoy talking about all of these things. Like sometimes it is important to not just talk about clinical things,
Right.
but about the things that go behind them. Because in a clinical setup, it's not always possible to talk about emotional needs or the other statistics that go along with it.
Yes.
We can just discuss depression and anxiety and the things behind it. But,
We are so blessed to have a psychiatrist come and
Thank you.
explain everything to us. I'm sure my
Thank you.
audience learned a lot.
Yeah.
Thank you so much for your time.
Thank you for having me. I had really nice time.
Thank you. That was a wonderful episode. I absolutely enjoyed it. I'm sure you would have enjoyed it as well. I really want you to take some points from this podcast, and I just don't want you to just think this podcast episode as just one off and then listen to this and then move on to the next one. I really want you to take some time to think about what we discussed and maybe write down in the comment section in terms of what are the things that you might change after listening to this podcast, so that gets registered in your mind and you will implement slowly in your daily practice. After all, we're all here to improve together, similar to how we have talked about physical health, diet, exercise a lot in our channel. It is high time that we focus on our mental health and we prioritize that over anything else as well, so that we can have both physical, emotional and mental health all grow together, so that we can have the wholesome, happy life in whatever we do, so that we'll be productive, we'll be active, and we'll make sure that all our family members are happy along with us. Thank you so much for all your continued support. Please check out our other channels called Gut Feeling with Dr. Pal Shorts, where we condense 1 minute reel out of this long podcast, just highlighting the salient points. And we also have another channel called Gut Feeling with Dr. Pal Clips, where it is an 8 to 10 minute video where we cut this long podcast into fewer clips, again highlighting the salient points. If you want to listen this in an audio format, we are available in Spotify as well. Please check out Gut Feeling with Dr. Pal. And thank you so much for subscribing to the channel, and that keeps us motivated to bring you more medical experts. And the goal of the channel is to create this as a widely available health podcast channel, so that every common person can learn something out of the podcast, so to improve their health on a daily basis. Thank you so much for your continued support.